Hi, I'm Annalisa Itkor, and I'm here today at the Hilton Head Veterinary Clinic. Now, today we're going to be discussing a topic that all Hilton Head Islanders should be aware of when it comes to the quality care of their pets. Joining me today is my vet, Dr. Kirk Dixon.
Dr. Dixon, am I correct in saying that heartworm is a major concern for pet owners here on the island?
It is a major concern for pet owners of the island, the entire state of South Carolina, and the Southeast.
Why is that?
That's because mosquitoes, which are the carrier of heartworms, are rampant here, and they're here all year round because of our temperate climate.
Can you give me an idea of, I know the mosquito plays an integral role, but how does the disease get passed from dog to dog?
Sure. This is a little rubber sample of a heart and heartworms.
I didn't think it was a real one, but okay.
I do have a real one, but I figured it'd gross everybody out too much. So anyway, this is a little rubber sample. This is the worms in the heart. They're about the size of a vermicelli noodle, maybe 6 inches long. And in the dog's heart, what kills them eventually is that it makes it very difficult for the heart to pump, and then they go into heart failure. But as far as spread goes, these adult worms lay little baby worms called microfilaria that are actually circulating in the bloodstream. When a mosquito comes along and bites a dog that has heartworms, they suck up these little baby worms or microfilaria, and then they incubate in that mosquito, and then that mosquito goes and bites another dog. 6 months later, have this.
What can I do to prevent this from happening to my dog?
We can treat a dog that has heartworms, and very successful, not anything like the rumors of that it'll kill them to treat them or whatever, but we do want to prevent it. That is the important part about heartworms, is to prevent it. So what we do is, we always have to test them, a dog, before we put them on preventative, because if we start preventative and they have heartworms, they can have a reaction that can actually kill them. So we do a blood test, make sure they don't have it, and then we put them on preventative once a month to prevent it. As a little side note, cats also get heartworms, which a lot of people don't realize.
I didn't know that.
They're not the natural host for heartworms, but they can get it. It usually doesn't get transmitted from them, but it can, and usually doesn't kill them, but it can create very significant problems.
So does a cat need to be on medication as well?
It's good to have them on preventative. Their incidence of infection is less, but the preventative is so easy to give cats now and also helps with fleas that it's a very good idea.
Can you give me an example of some of the
Sure,
preventative?
I'd be happy to. Here are some of them. This is HeartGuard, once a month tablet, helps for heartworms.
This is what I give my dog.
That's a very popular. Most dogs really like it. Interceptor, another once a month that does just heartworms. There's Sentinel, which prevents heartworms. It's Interceptor plus a product that breaks the life cycle, as fleas can't lay viable eggs. There is Revolution, which is my personal favorite for both cat and dog. This not only prevents heartworms, but it also kills fleas and does help with ticks.
Oh, great, great. So there are a lot of options.
There's a lot of options. We can vary everything even down to some generic products that can save money for those that have a really tight budget, but these name products are the mainstay of what we use and people desire.
Speaking of name products and budgets and things like that, and forgive me if I'm bringing up a touchy subject, but I've seen medications like this advertised on television that you can get them on the internet a lot cheaper.
And that is an advertisement. Unfortunately, a lot of that isn't true. You know, the big main brand of internet pharmacies, you know, they say you're going to save half the price. You're not going to have to wait 30 minutes standing in line. Things that just don't happen, you know, in a veterinary office. There are things that are somewhat cheaper, a little bit, but there's things that are also much more expensive. I'll give an example that I drew just today is Frontline. Very common product, we use a lot of.
I use it.
Okay. On the internet, PetMed Express today, I looked up their product. For the 6-month supply, it's $77.99. Our product, when you buy the 6-pack, because it's endorsed by the manufacturer, you get a 7th tube free. So Our 7-pack, you could say, is $80.55, including tax. I've already paid sales tax on this, so I don't have to charge when I sell it. If you net this down to an equal basis 6-pack to 6-pack, our 6-pack price would be the equivalent of $69.04.
So this is saving you money getting it at your vet's office.
Saving $8 while very convenient, just stopping by, picking it up, simple. We stand behind the product. People don't understand that veterinarians are the only ones, we are the only ones that are able to acquire all of these products you see here from the manufacturer. Every other source, all those popular internet pharmacies, they cannot get it from the manufacturer. Where they get it has been very varied and we'll say unique, but only veterinarians can get it from the manufacturer.
That actually brings to mind, I must confess, I acquired some flea medication for my dog, same name as the product I would get in your office, and it made my dog sick.
Unfortunately, we've received many notifications from the company about counterfeit product. That packaging looks identical, and these companies, whether it be pet stores or anybody else who are trying to get quality product, their desire is very good, but they have to get it from a middleman who they have no idea where it's coming from and could very much deceive them and confuse them. So even though they try to provide that product and think that they're doing a good job, it very possibly may not be that product and could create an issue for the pet.
So really, the long and short of it is, preventive care is the way to go for heartworm with medications that we get in your office if you really want to be taking good, safe care of your pet.
We make every effort to be competitive, to have the best products, to have things that will work for the animal and will be safe for them.
We learned a lot from Dr. Dixon today. First of all, you want to make sure that you're purchasing your medication from a known veterinarian's office. It's the only way you know that your pet is going to be receiving medication that is from the manufacturer and safe. Second of all, you want to have your pet tested for heartworm and put on a preventive medication like HeartGuard year-round. That way, you know that your pet is going to be in good health. Be sure to stay tuned for future episodes where we discuss more about how to ensure your pet's good health. Have a great day.